right. All right, here we go. Now, go ahead. All right. Now, so welcome to the Crusades. This is a camp of combined Hospitallers and Templars. We're orders of monks, and we spend our time in prayer and fasting. Well, there's a little more to it than that. We also provide armed escorts for pilgrims traveling to the Holy Land to protect them from marauders, raiders, and kidnappers. We also act as the vanguard and rear guard for armies of crusaders when they come to the Holy Land. We also provide services for pilgrims who come by providing places in our castles along the way for both orders, where you can deposit money, take a receipt, take that receipt to the next castle along the way, and trade it in for money. In other words, you don't have to carry money for the whole trip with you. You can redeem, make deposits, and redeem it. That's right, exactly. So, at any rate, but the hospital order, in addition, has as part of its mission caring for the sick. The motto of the order is Tuitio Fidei et Obsequium Pauperum, which means defense of the faith and service of the poor. And the poor include not just those who have no economic means or food to eat, but also those who are poor in health. We run a big hospital in the Kingdom of Jerusalem, actually two. We have one in the city of Jerusalem with about 900 beds, and we have another big one in the city where we are here today, Accra, along the coast of the Mediterranean. Now, in our hospitals, there are only 4 actual doctors, and they're not members of the order. They're employed by the order, and there are also surgeons. The surgeons are not members of the order either. There are not enough of them to be able to care for all the wounded and injured after a battle, or if there's a big epidemic. So as a result, although the Pope has officially prohibited monks from engaging in the practice of medicine or surgery, we've been given dispensation by the masters of our order to learn techniques from the doctors. So the doctors are the ones making the decisions, and we, as a group of 4 humble serving brothers today, or 3 humble serving brothers, are going to practice the techniques which the surgeons and the doctors have taught us.
Like physicians' assistants.
That's right, but we're going to try this on our own today, because that's what's going to happen after a big battle, all right? All right, so I'm going to provide medical care, which has to do primarily with philosophy and herbal supplements. And these 2 are going to provide surgical care, which has to do with cutting, all right? So, our patient has come in from the battlefield, and as you can see, he's got a crossbow bolt in him. Now, you might say, why not just pull out the crossbow bolt? Well, the problem is that in medieval warfare, it is quite common to attach crossbow bolts, arrowheads, by nothing more than wax. So when the arrow goes in and you pull it out, the arrowhead stays inside the victim. So we're going to have to employ some surgical techniques to be able to retrieve that arrowhead.
I think I've found it.
Okay, you found it. Okay, so he's using a probe, and hopefully he's discovered the orientation of it. Now before you do that, which he's right now he's screaming in pain.
Calm down, calm down.
Yes, right, we have a little something for you. This is where I come in. We do have some herbs available to help take pain away. The first of these is hemlock. You may recall hemlock from Socrates, a deadly poison, but in just the right mild dose, hemlock can relieve pain, reduce the sensation of pain. Now, to prepare the tea for this, I'm going to take a little bit of a substance called quicklime. Quicklime is made from seashells baked at high heat in an oven, and it produces a special chemical which, when water is added to it, releases a huge amount of heat. So I'll take my canteen, I'm not going to put it out to make a mess, add a drop of water to it, it begins to sizzle, and I instantly put my metal cup on top of it. That's going to start to heat the water, an immediate portable source of heat. And now I'll start putting in my ingredients. First, hemlock. Now there's a new miracle drug. We've learned the use of this from the Muslims, who in turn have learned it from the Indians a few centuries ago. This is the bulb of the poppy plant. And I'm going to...
You Vietnam guys know all about that, don't you?
If I might borrow your scalpel a moment. I'm going to make an incision in the shape of a cross, because after all, we are a religious order, in the bulb. Not more than 2 cuts, just 2 cuts, not less than 2 cuts. And immerse this in the water. All right.
5 is right up.
Well, 5 is too many. Now, hemlock, when prepared as a tea, tastes like mice smell. So, in addition, I'm going to add, actually I already put it in there, some petals of roses. Roses are important for a couple of reasons. First of all, they do sweeten the flavor a little bit, but even more importantly, they help balance the bodily humors. There are 4 fluids in the body that are essential for good health. Blood, phlegm, yellow bile, and black bile. These are the teachings of the Roman physician Galen from about 1,000 years earlier. There's no reason to change his philosophies because they seem to make sense. And rose petals being red will help balance the blood in the patient because you're going to lose some as part of this process. So allow that to steep for as long as it takes to say 3 paternosters. No more than 3, no less than 3. In the meantime, we have a wound here which hurts like crazy. I prepared a separate little elixir here made of olive oil, animal fat, and once again, the bulb of the poppy plant. And I'm going to apply a little bit of it right into the wound. And he's going to absorb that poppy sap, and it's going to make this wound site not hurt so badly. All right, we set our 3 paternosters, no fewer, no more. It's time to remove our poppy sap and hemlock sap. Have the patient drink up. We'll let him absorb that for the time it takes to say 3 more paternosters, and now he's ready. Now, the wound from the crossbow head is not big enough to allow the arrow extractor to fit. So he's actually going to enlarge the wound to allow the arrow extractor to fit. And once again, I'm ready with my opium salve. Maybe a little more. Well, I don't hear any screaming. Must be doing all right.
The arrow spoon goes in.
Now, in medieval medicine, the patient usually does not lie on the table, but rather kneels on the physician's legs. That bodily contact, we don't know the reason for this, but that's how it's shown in period illustrations. It may provide a little human contact. It may allow the surgeon to be able to manipulate his body better. Now, he's not feeling any of this, so don't be concerned about the patient. All right, we've successfully removed the arrow, and I think he's going to need a little bit more.
He'll be fine. Get the cauterizer.
All right, all right. And now it's time to suture the wound. Remember, through and then back through the same thread. Here's a knot, so just don't. There you go. Back through the same way.
Hung up on his leg.
Yes.
Hung up on his leg, sure.
What's the worst of all possible things to happen? It's gotta feel good. This is why we practice on chicken legs. really are the consultants. Look, the consultants are the 4 physicians who have 900 patients to take care of. But we've agreed to take to learn these techniques. So they say agreed in order to do it.
What's the difference between the hospitallers and assemblers?
Well, the difference, we all do exactly the same things, but the hospitallers in addition are specifically dedicated to medical care. All right.
I'm
now,
a Templar.
He's a Templar. This is honey.
White with the red cross. I'm a Templar. You're a hospital.
And we're hospitallers.
I'll explain it to you in a little funny stuff.
I'm adding honey to the outside of the wound.
Antibacterial.
Sorry?
Antibacterial.
Bacterial.
It helps.
All we know is that other things don't grow in honey. And honey helps keep the tissues from drying out. Any other questions we can't answer because they haven't been invented yet? Okay. And finally, we'll bandage it.
I got something struck. If there's a fever, when will it appear?
It'll be within a day. There we are. And now the magic of honey, when used as a treatment for covering for wounds, rather, is that unlike bandaging without honey, where you have to keep adding more and more layers of bandaging because you pull it off, you'll open the wound up again. Honey allows you to remove old bandages and place fresh bandages because it won't tear off the tissue that's healing underneath. All right. All that remains for the patient to do is to say his paternosters, and he should be all right.